Behind each face is a story of a degrading lack of care. Some were left without food and drink. Others lay in soiled sheets for hours. All were deprived of basic dignity. And these are just a fraction of the patients who could have died unnecessarily. Their relatives have long campaigned for accountability, and they're angry that an independent inquiry into failings at Stafford Hospital was held behind closed doors.
This has been a secret inquiry set up by the government. It's a secret inquiry for Andy Burnham, that's what it is. Nothing more and nothing less. This hasn't helped any one of us sitting around this table. In fact, this has just made us stronger now. Made us stronger to campaign for the truth, because we don't feel that we've got the truth.
Who is trying to cover things up? Why are they trying to cover things up? People have died here. These are our relatives that have died here. Our lives are destroyed because of it.
The report found that a preoccupation with cost-cutting led to a chronic shortage of staff. There was a culture of fear and bullying within the hospital, and some staff showed a disturbing lack of compassion towards patients. Of the thousands of employees written to by the inquiry team, only 80 responded. Despite this, the report's author stands by his decision not to hold a public inquiry.
This was not a secret inquiry. Anyone who reads this report and says that it's a secret, still says it's a secret inquiry, is not reading what is there.
The families welcomed news that the conduct of individual doctors and nurses would be investigated, and they accept that a new chief executive is desperately striving for change.
The first thing we've done is we've put more nurses into the hospital, and particularly onto the wards. In fact, over the last 12 months we've recruited an additional 140 nurses to work on the wards there.
A further inquiry will now look at how all the regulatory bodies failed to spot the routine neglect at Stafford. But campaigners say that until the truth is heard in public, they simply won't be able to move on or once again place their faith in their local NHS.